A 16-year-old high school student goes to see the school nurse because of severe eye pain and a feeling that there is something stuck in his right eye. He does not wear contact lenses. He reports that he was recently working with machines in shop class without wearing protective goggles. Ophthalmologic examination reveals no visible foreign body in the eye. Visual acuity is slightly decreased at 20/30. Pupils are equal, round, and reactive to light bilaterally. Corneal reflex is intact, and extraocular muscles are intact, although the student says his right eye hurts when he moves it. What is the most likely diagnosis, and what are other causes of acute unilateral vision impairment? The student has a corneal abrasion, which typically presents with significant eye pain and a foreign body sensation. The patient will also have photophobia. This patient's history suggests the source for his eye injury, working with machinery without wearing protective eyewear. Other etiologies of acute unilateral vision impairment are optic neuritis, swelling or inflammation of the optic nerve, retinal detachment or tear, giant cell arteritis, inflammatory autoimmune disease of large blood vessels, and amaurosis fugax, temporary vision loss in one eye. What are the layers of the cornea? The outermost layer of the cornea is the corneal epithelium, which is fast-growing and undergoes constant physiologic renewal. The next layer is the Bowman layer, an acellular layer composed of collagen. Next is the corneal stroma, followed by Descemet membrane, and finally the corneal endothelium. What is the pathway of the corneal blink reflex? The excruciating pain experienced by this patient is due to the rich innervation of the cornea by the ophthalmic branch of trigeminal nerve, cranial nerve 5. This nerve constitutes the afferent portion of the corneal blink reflex. After synapsing in sensory nucleus of cranial nerve 5, there is bilateral projection to nucleus of cranial nerve 7. From there, motor fibers project to the orbicularis oculi muscles, causing a direct ipsilateral and consensual contralateral blink response. What space lies between the cornea and the lens? The space between the cornea and the lens is the anterior compartment, which is subdivided by the iris into the anterior chamber and the posterior chamber. The entire anterior compartment is filled with aqueous humor, which is secreted by the ciliary body. From what embryologic structures do the cornea, iris, ciliary body, lens, optic nerve, and retina develop? The optic cup is an embryologic structure derived from neuroectoderm, diencephalon, that gives rise to the retina, iris, and ciliary body. The optic stalk, also derived from the neuroectoderm, creates the optic nerve. The lens is derived from surface ectoderm. The inner layers of the cornea are derived from mesoderm, and the outer layer derives from the surface ectoderm. What are the types of refractory errors? The cornea is responsible for most of the refractory power of the eye, and the lens is responsible for the rest. The lens and cornea work together to project an image perfectly onto the retina. A mismatch in cornea and lens refractory power results in refractory errors. A far-sighted person will have hyperopia. Hyperopia means the image created by the cornea and lens is projected behind the retina. A nearsighted person will have the image projected too far ahead of the retina.